I'm pleased to recognize my friend from Kentucky, a champion for people's health, for wildlife and the environment, an outspoken critic of destructive mining practices, and the sponsor of the Appalachian Community's Health, emphasis on health, Emergency Act, a bill on which I am pleased to join him as a co-sponsor, Mr. Yarmuth of Kentucky.
For how much time?
For 3 minutes.
The gentleman from Kentucky is recognized for 3 minutes.
Thank you, Mr. Chairman. Thank you, Mr. Holt, for yielding. This bottle is filled with water from a well near a mountaintop removal mining site in eastern Kentucky. In case you can't see it, the water is orange. This is what comes out of the taps in Appalachian communities where the water is contaminated by dangerous mine waste, which fills their wells and flows through the streams in their yards. It's the result of an inadequate law that is failing to protect public health and safety near mountaintop removal mining sites. But today, rather than examining ways to strengthen that law and begin to address the public health crisis that accompanies mountaintop removal mining in Appalachia, we're debating a bill that would make it worse. Mining communities already have more instances of chronic pulmonary disorders and hypertension, as well as higher mortality rates, lung cancer rates, and instances of chronic heart, kidney, and lung disease. Proximity to mountaintop removal mining operations also correlates with a higher risk of birth defects and damage to the circulatory and central nervous systems. And yet, instead of finding ways to better balance public health and safety with coal mining, or at least working to prevent mining companies from turning our water supply this shade of toxic orange, we are debating a bill to roll back what little protection the federal government currently offers these Appalachian communities. I sympathize with my colleagues' desire to protect jobs in the coal fields, and the loss of 75% of eastern Kentucky coal mining jobs due to mechanized mining over the past several decades has brought challenges. But a rule to protect waterways that's been in effect since 1983 is not the source of those challenges, nor is addressing the public health crisis that has unfolded in Appalachia as a result of mechanized mining. No one here would risk their health by drinking this water. If any of my colleagues want to prove me wrong, I invite them to come have a sip. It's bad enough that children who live in mining communities color their streams orange when they draw their environment. But it's tragic that the water they drink is denying them the healthy future they deserve. We are risking the health of families in mining communities in Kentucky and throughout Appalachia by continuing to ignore the toxic orange water that pollutes their drinking supply. I urge my colleagues to stand up for public health and vote against this legislation. I yield back.
Gentleman